Hey guys, today we're going to talk about bioterrorism. So this is a topic that might help you in your adult section, or if we're not teaching it anymore in adults, then you might also need to know about it when you go into complex. So let's talk about terrorism in general. So terrorism in general, and we're talking about bioterrorism, we're talking about biological terrorism, but as a whole, it's the use of dispensing of nuclear, biological, chemical agents and using them as weapons. So examples of this would be anthrax, smallpox, botulism, or the plague. Now, this is not something that's necessarily common, but I'm sure in your lifetime, depending on how old you are, I know some of you guys are younger, you may have seen some of these used as bioterrorist threat at some point in your life. When we talk about bioterrorism, we do not want you to know in depth about each of the disease processes and like which ones get, antibiotics or which ones have vaccines, but we just want you to know the general nursing care and what you're going to do if this patient walked into your unit and how you're best going to help. So, as the nurse, your role in a bioterrorist threat is to recognize when there is an acute threat, in which we're going to talk about what that looks like. Your other role is to know what priority actions to take to prevent the spread, and then knowing basic treatments and care for these patients so that you can help them to improve or get better. So recognizing an acute threat. So you want to know what the common symptoms are for bioterrorist threats. So common symptoms are going to be either respiratory symptoms. So think things that are like flu-like symptoms, like fever, cough, runny nose, that kind of stuff. But the difference there, let me finish this first. So respiratory symptoms like flu-like symptoms, or GI symptoms like nausea, vomiting, diarrhea. But the key here is because you're probably thinking like, hey, a lot of people come into the ER with this stuff all the time. So how am I going to know that it's for that like it's something that I need to pay attention to? So the way you're going to know is you're going to see a high number of patients coming in with this. It's going to be like a sudden increase. Like all of a sudden there's like 50 people coming in all with the same diagnosis. There's like a sharp increase in the amount of people getting something. So look for those respiratory symptoms and then those GI symptoms. So priority actions as a nurse. So what can I do as the nurse? In the event of a mass casualty, you need to know how to triage. So this is if you've ever watched Grey's Anatomy or something like this, where they had that boat episode where they were triaging and giving them different tags and stuff like this. There's two things to consider with triage. We're not just looking for who the sickest patient is. And we're like, oh, I got to take care of the sickest patient first, but we also have to think about their chance of survival. So if you're ever in a mass casualty accident, et cetera, and you're trying to figure out who to help, you have to consider who actually has a chance for survival, but also who has the greatest need. So we generally mark them colors. So red is going to be the most urgent or priority patient. So red is going to be like, hey, this patient, they have a chance of being saved and they have the most urgent need. Yellow would be very urgent or second priority and still have a good chance of survival. Green would be they have minimal injuries, low priority, they can be okay for a while without being brought to the hospital. And black would be dead or dying, or there's no hope for survival. So sometimes you have to just kind of consider, the depth of their injuries and things like that, not just how sick that they are. And then let's say we're going back to the bioterrorism thing. Let's say that you have a bunch of patients that are coming in with those same symptoms, those respiratory and GI symptoms. What do you do there? The most helpful thing you can do in that situation is prevent the spread. And so we do this by quarantining. If we see a bunch of patients coming in with, a problem, we actually start to create quarantine units or places where we're putting these patients, especially if there's a lot of them, we have to find more of a common place to put a bunch of them, just to make sure that they're not spreading it. Because the biggest thing with bioterrorism is we do not want to spread it. We do not want other people getting it. So we quarantine and isolate is one of the best things that we can do. It's a priority action. So let's talk about basic care and treatment. And I'm not going to talk about basic care and treatment for mass casualty, because that's something you will learn later in complex, or you'll do a disaster drill then. But basic care and treatment for bioterrorism would be prevention. So a lot of people that are high risk. So if people are working in areas where they may be exposed to a bioterrorist threat, they may already be vaccinated. Like a lot of people in the military have to be vaccinated against anthrax and things like that. Prevention is always key, especially for those that are high risk, but most people are not going to be vaccinated for these things. So, but the good thing is that even if they're not vaccinated, there are a lot of vaccines available for these treatments. They may also be treated with antibiotics or antitoxins. And then we want to do supportive care like oxygen. If they're treating their symptoms, so if they're not breathing well, we give them oxygen, antiemetics if they're having nausea, and if they're experiencing any pain, we'll do pain management as well. So that's pretty much bioterrorism. I know it's exhilarating, so I hope you had as much fun as I did. See you next time.